So this patient presented with grade 2 gynecomastia, and he developed his gynecomastia during puberty, which is a very common time. And you can see on the front view the fullness and the bottom heaviness of his chest. The areolas look a little bit larger because they're being stretched out by that breast tissue. And now on the oblique view, you can see how much coning he has in that areola on the chest on both sides, but then also that shadow underneath the chest from the breast tissue blocking the light. And so the goal in this surgery was to give him a much more balanced chest. And I did this with a combination of vaso liposuction, but really excision of that breast tissue. And here you can see now at 6 months, such a better contour. His chest is in proportion with the rest of his frame. No more bottom heaviness to the chest. On the front view, notice the smaller areola because they do shrink sometimes when you're taking that tissue out. And then on the oblique view, you could see a much better transition from the upper pec to the middle pec to the lower pec, and no more coning right at that areola. And appreciate the angle that the breast makes with the abdomen. It's a much more oblique angle. And so he did really well and will continue to do well as he continues to heal. So this is a patient who came to me with grade 3 gynecomastia. Now, his gynecomastia was caused by using anabolic steroids. And when he came to me, he had a lot of tenderness in his breasts as well. And so you can evaluate him here. Like, he's got a lot of breast tissue, a lot of projection. You can see the size of his areolas, and keep in mind for the after pictures, how they shrink. But also when he gets into the 3/4 position, how much that breast comes out and the angle that his breast makes with the belly. And keep in mind for the after picture, how much better that gets when the tissue comes out. So I did a full resection of his breast tissue because I had to be pretty aggressive, knowing that he had a lot of pain caused by the breast tissue. And you can see now, it's about 6 months out, how much improvement there is in the projection. His areolas are smaller. His angle of the breast to the abdomen is much better. It's not at that 90 degrees. And with these grade 3s, you always worry a little bit about skin tone and whether that skin's going to be able to retract. I thought he was going to do fine, which is why I didn't elect to do any other skin excision scars on him. And he did great. And also his pain went away. So he got a really great result, both physically, emotionally, as well as symptomatically with the pain. So this patient came to me with grade 4 gynecomastia. And here you can see on the front view, things that make it a grade 4 are just, one, the sheer size of the breasts, but also how much they're hanging. There's a lot of extra skin. The areolas are very large, and the nipples are in a very low position compared to where they should be on his chest. And if you look on the 3/4 view, you can see he's also got a lot of fullness in his side chest that extends from the center. And so when coming up with the surgical plan, got to treat all of it. You can't just treat the front and have no relationship to the side. So the best surgery for this is a double mastectomy with free nipple and areolar grafts. And so now you can see here at 6 months out, he's got much more flattering chest contour. It matches the rest of his frame. The incisions are healing nicely. They will continue to fade over the next year and a half. His areolas are smaller and brought up to a more normal location for a male aesthetic. And then on the 3/4 view, you can see it meshes very nicely to the lateral chest. It's that fullness that he had on the side chest is gone. So the front chest and the side chest make sense together now. And he's ecstatic. He was very kind of self-conscious and embarrassed about wearing shirts in public. And now he told me he feels like a weight has been literally and figuratively lifted off his chest. So this patient came to me because he's unhappy with his chest. And so you can see from the front view, he's got a lot of fullness in his chest, and he's also got large areolas, which he was also not happy about. He wanted those areolas to be made smaller. Now, he's also had some weight fluctuations in the past that left the skin a little bit looser than what you would expect for someone that age. And now when you look at the oblique view, again, he's got a lot of bottom heaviness, but a lot of projection of that breast as well. Not to mention, you can also see that areola is a bit larger than what standard areolas are. So here now we see him 6 months later. My surgical plan was removing all that breast tissue, but also doing an areola reduction, which helps the skin get tighter as well. And so on the front view, you can see a much better contour of his front chest, but look how much proportionate the areolas are with his chest. And now on the oblique views, you can also see a nice transition from the upper to the lower pec. No more over projection. That nipple is set back nicely on his chest, and also that incisions healed beautifully. So he did great 6 months out, continuing to do great. Very happy with this result. So this patient came to me from out of state for revision gynecomastia surgery, and his history is this. He lost a fair bit of weight, and he went to his local surgeon where they did liposuction, removal of the gland, and Renuvion. Now, Renuvion is a minimally invasive skin tightening procedure that uses a helium gas to try and shrink the skin. I don't actually think it works very well for gynecomastia, but that's the topic for a different video. And so you can see on his before, he's got a deflated looking chest, hanging skin. His nipples are way too low. They're not even really on his pec muscles. And so the only real definitive solution for this is to do a double mastectomy to cut out that skin. It's really body contouring to remove the areolas and put them up in the proper location. And so now you see here a year later, he's doing great. His incisions have healed fantastic. His contour is great. You can see his entire pec definition. Nipple areolar grafts are healed great. And you can see on the side view as well that his contour continues to be really nice. You can see the entire lateral pec border. His incisions have healed really nicely. And this was the right surgery that he needed. When people lose a lot of weight in their belly, they get a tummy tuck, not just liposuction. So why wouldn't it be the same with the chest? You got to treat all the components, not just the fullness, but also the nipple position and the skin laxity.